BSI, scene safety. Mechanism of injury is rollover with ejection. I have one patient. I need ALS en route. I need a partner to maintain C-spine immobilization. My general impression is it's critical due to ejection. Hey, can you hear me? Are you all right? No response. We'll do a pain. He moans, so he responds to pain. Are there any life threats? We'll say no. I'm going to look, listen, and feel. I'm looking for equal chest rise and fall, listening for air, feeling for air. I see equal chest rise and fall. I feel air and hear air, so that tells me my airway is open. What's the respiratory rate, rhythm, and quality? 16 and labored. Let's put him on 15 liters a minute, non-rebreather. Does he tolerate that well? Yes. I'm going to check carotid and radial pulse at the same time. Let's say he does not have a radial, but he has a carotid. I want rate, rhythm, and quality of the pulse, blood pressure, skin temperature, color, and condition. 130 and thready, 60 palpated, pale, cool, and clammy. He's exhibiting signs of shock. We're going to keep him warm best we can as we do continue our assessment. There's no bleeding that we need to assess. Due to him in shock and his mechanism of injury, he's a high priority, so we're going to go ahead and prepare him for transport. I want to check tracheal deviation, jugular vein distension, and palpate his neck. If all that is within normal limits, which it is, we're going to put a C collar on him. I'm going to get the appropriate amount of people on his head count. We're going to log roll him. I'm going to check his lumbar, buttocks, and back for any injuries, DCAT, BTLS. We'll say they're within normal limits. We're going to place him back on a long spine board, strap him nipple, navel, knee, secure his head. We're in the ambulance. Since he's responsive to pain, he can't give me a sample history. Is there anybody on scene that can? We'll say no. Now I'm going to do my head to toe. I'm palpating his head and his scalp for any injuries, any DCAT, BTLS, battle signs, drainage from his ears. If there is drainage from his ears, we can do a halo test to see if it's cerebral spinal fluid. We'll take a 4x4 and fold it into halves. Get the fluid on, unfold it, let it set and dry. If there's a red ring, it tells us there's cerebral spinal fluid in it. We're going to check his eyes, his pupils. Are they equal, round, and reactive to light and accommodation? Any Coon's eyes? Any injuries to the face? None. Just, he still have non-rebreather at 15 liters a minute. If he does, we'll ask if he's tolerating that well. We'll say yes. Neck is done. I already asked for equal chest rise and fall. That was stated we did. Now I'm going to palpate for any other injuries, any bruising, any deformities, anything I need to know about. We'll say there's none. I'm going to listen to all 4 lung fields. Present, 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 present. I'm going to palpate all 4 quadrants of the abdomen. We'll say it's soft. I'm going to do a pelvic rock and tilt. We'll say it's intact. We're going to sweep for a priapism. Start with this leg. I'm going to check it for any injuries, any DCAT, BTLS. I'm going to do a pulse, absent, capillary refill, very sluggish. Can he wiggle, can he feel? He doesn't respond. This leg, DCAT, BTLS, pulse, capillary refill, can he wiggle, can he feel? There's no pulse, sluggish capillary refill, and no response on the wiggle feel. This arm, need DCAT, BTLS, we'll say it's within normal limits. Again, a pulse, absent, capillary refill, very sluggish, can he wiggle, can he feel? No response. This arm, DCAT, BTLS, is within normal limits. We'll do another pulse, it's absent, capillary refill, can he wiggle, can he feel? No response. I'm going to continue transport, continue oxygen, monitoring his airway. I'll get vital signs on him every 5 minutes and continue to monitor for any other changes.
Thank you.